The broadcast is now starting. All attendees are in listen-only mode.
Welcome to today's webinar called Financial Solutions, Prioritization, and Cost Containment in the IT World. My name is Katie Tarr. I'm a Senior Analyst with LBMC located in Nashville, Tennessee. Just a note before we get started and run through some housekeeping items, those slides for the presentation today are on our website, and you can find that link in the chat box to the right of the presentation. Just to go over a few upcoming events for HFMA, registration will be open shortly for our next webinar next month. That's on March 10th, a Tuesday, and the title is Learn to be Lean. It'll be presented by Ann Pontius. She is a senior medical practice consultant with State Volunteer Mutual Insurance Company. You can visit tnhfma.org/webinars for more information. We also have registration for the Dixie Institute, which is open now, and it's going to be held February 17th through the 20th. It's an annual conference that brings together HFA members from 5 different states, including Atlanta, Florida, Georgia, South Carolina, and Tennessee, and it will be held in beautiful Charleston, South Carolina. You can visit hfmadixie.org for more information. We also have the upcoming Kelly Miller Payer Summits. Registration is open, and they're going to be held on various dates and at various locations between March 18th and March 26th. They will be one-day sessions with the most prominent Tennessee payers, including Blue Cross Blue Shield, Cigna, United Healthcare, and Health Spring. You can find more information as well as agendas and specific dates and locations for these payer summits at tnhfma.org/payer-summit. And lastly, we want to be sure that you save the date for our Spring Institute that will be held on March 18th through the 20th in Franklin, Tennessee. A few items of note for our webinar today. To obtain CPE certificate, you must be connected to the webinar for at least 90% of the duration of the webinar, and you must respond to at least 2/3 of the polling questions. Today we have 3 polling questions, so the math is easy. You just need to answer 2 out of the 3 questions. With that, I'd love to introduce our speaker today. Her name is Jackie Lucas. She is a collaborative leader with a broad background in business, healthcare, technology, finance, consulting, and education. Ms. Lucas's experience includes being a senior executive of a large enterprise health system and holding leadership and management positions in healthcare information technology, operations and finance, academic and children's healthcare as well. She has been involved in corporate strategy, budgeting, mergers and acquisitions, and analysis of new and existing business ventures, programs, and products. She has experience in healthcare consulting as well. Ms. Lucas is a fellow of the American College of Healthcare Executives and a member of the College of Healthcare Information Management Executives. She has served on advisory boards for multiple organizations, including 2 Fortune 15 companies. She has received awards, including being named a Computer World Premier 100 CIO IT Leader. She has been published and spoken nationally on healthcare operations and partnership, change management and expense reduction, electronic health record and clinical systems implementation, and program project management. Ms. Lucas has taught graduate MBA and MHA courses and served as an industry instructor for information technology and quality for the American College of Healthcare Executives. We welcome Ms. Lucas today to present Financial Solutions, Prioritization, and Cost Containment in the IT World.
Good morning or good afternoon, depending on where you are in Tennessee right now. I want to thank you for your time today, and I always believe that if one person comes away from a presentation or webinar with something positive, that's a very good thing. So I'm going to get started on our material and talk with you about financial solutions and how to prioritize IT projects that lead to cost containment in information technology. And in that presentation, I will talk about change drivers in healthcare and finance, any of the challenges in healthcare IT today, and the best practices and processes that can help drive not only IT success, but certainly cost containment at a time when we really need that in the industry. And I'm going to talk about IT cost containment tips and takeaways, some solid areas that are outside of the process area. I think we all know a lot of the change drivers that are in healthcare. I've been in the industry a long time, and I've never seen a time that I think is more challenging than today to be managing in the industry, either from a financial and IT and operations, physician, any perspective. It's very much a changed world, especially in with everything that's going on. I did, and some of you have downloaded and may have looked at my notes, I did a literature search when I started this presentation, and I thought I would find all this material about how to save money and cost containment, and what I found was a lot of material from 10 years ago, from around 2005. And I was certainly in the industry then, and I started reading some of it just out of my own curiosity, and what I realized was, except don't put meaningful use in there, or accountable care acts, value-based purchasing, but I was basically reading the same material we talk about today in terms of containing cost and the reasons to do that. So I found that very interesting that 10 years down the road, we're still talking about trying to handle cost containment and success of IT projects. So some of the things impacting us with healthcare reform and regulation, obviously meaningful use, accountable care, value-based purchasing, readmission reductions, physician quality reporting systems, hospital-acquired conditions, patient experience, and ICD-10. Fiscal restraint is certainly necessary in the industry today. Healthcare has reached 18% of our GDP, and at the current trajectory, we would be at 34% by 2040. We've had many changes in delivery and reimbursement models, high deductible plans where someone may have to spend $10,000 before there's really reimbursement from the insurance, at-risk models where providers and even physician practices that may be part of an ACO are going at risk, Medicare rates look like they're going to be set as a standard. For many organizations, financial viability is an issue, and especially critical access hospitals. Mergers and acquisitions seem to be the norm. We're seeing increased demand and sustainability at that same time, an aging population, chronic disease such as diabetes, COPD, and congestive heart failure, the need to do more with less, and a strong need for innovation and integration out of the IT area to prevent inefficiencies and duplication, to integrate across the care continuum, and even though we have electronic health records, I think we all know we're not fully integrated. And physician employment has been a huge change for all of us, with that reaching over 50% of physicians. Other change drivers are patient-centered care, empowerment decision-making. As people pay more of the out-of-pocket expenditures, they really want to drive more of those care decisions. The need for patient engagement. Patients do need to be more responsible and accountable for health and wellness. We'll never counteract some of these chronic diseases without getting them engaged in their health care. And fiscal responsibility. Patient experience. You see a lot of, you can't pick up a healthcare magazine that you don't see the need for patient experience and patient loyalty, which ties very closely together. As we talk about healthcare, there are many challenges in healthcare IT today, and in my presentation I'm going to talk about how you handle some of these issues. There's just, frankly, in all areas, too much demand and competing priorities. I don't think there'd be anywhere in IT, in a healthcare organization, that they wouldn't be seeing this. Few vendor options with very high vendor dependency, the highest I've seen in a 30-year career in the industry. Cost and resource pressure. A lot of people seeing IT as a silver bullet or a perfect pill, and we know those are not in the industry in any way. Extreme demand for timely and accurate data, the need for analytics, the need for informatics, and not only to be able to use the data as it's occurring and being able to get to it, but make sure it's accurate. HIPAA and security concerns, regulations like meaningful use and ICD-10, IT staff recruitment and retention, which often you find yourself in IT, you're not only competing with healthcare organizations, but you're competing with non-healthcare and larger industries, even maybe Fortune 500, even Fortune 50 companies. Lack of executive and stakeholder support, change management and innovation needs, explosive growth in systems and support, So we've talked about physician employment, need for EHR adoption, not just to implement but actually use the system, need for business continuity as we have more and more systems and electronic health records, and mobility and bring your own device demands. So most opportunities in healthcare to not only be successful but have cost containment come from a business-aligned strategy and good leadership, successful IT governance, executive and stakeholder engagement, prioritization of projects that I can't say enough about how important that is, using best practices and processes, and good program and project management in the IT area. So these are areas I'm going to talk about. IT vision and strategy is extremely important, and it has to align with the enterprise and the business. IT is not there for the sake of IT or technology. I see that as one of the most guiding principles of information technology leadership. It should be guided by the enterprise financial resources, whether it's a multi-entity, academic medical center, children's, or a critical access hospital. Any IT vision and strategy has to be within the organization's financial resources. It must address the changing healthcare landscape and be proactive. It must be developed collaboratively with the leadership in the organization, stakeholders, users, physicians. It must be approved by the CEO, executives, and the board. Must support organizational success, or why are we doing it? And at least in the long run, affect positive change. I think we all know with implementations, they're not always seen as positive when they first go live, but it needs to have that long-term reach. IT vision and strategy should be achievable. It should be understandable, not filled with tech jargon. It should be clearly communicated that anyone who is a stakeholder or user in IT can understand it. It must be supported by the organization, and one of the ways to do that and get people really engaged in these expensive IT projects is to consider making IT a part of your corporate goals and your management and staff goals, getting everyone on the same page, making sure they understand it, and making it a part of being on the same team and having common goals. IT vision and strategy should be strongly reinforced by an IT operational plan. You must have time frames for milestones, deliverables, projects. You must have a strong budget planning, and you must have the staffing in place, the resources to do the project. There must be accountability for the reporting of progress, deliverables, and budgets, a very important area. You really must track what's going on in an IT department and ensure that the CFO, finance, CEO, management, that everyone has the transparent information to understand where the strategy is and how it's being backed up as a plan. The area I believe is the very most important factor in managing not only IT but managing the cost in IT is the IT leadership. The CIO, or whoever your IT leader is, they may not be a chief information officer, must be a leader. They must be willing to lead. They must be accountable. They must be able to handle the positives and the negatives. They must oversee and manage the IT functions, the selection process, vendors and contracts, implementations and deliverables. Must be willing to mitigate risk on projects, implementations, and the day-to-day support. And they must be able to develop and manage budgets. The most important factor, again, that leadership also extends down to IT managers and supervisors. One IT leader, CIO director, can't make it happen without the help in managing the day-to-day operations. They must build relationships with stakeholders and users, not just from the top, but the managers, the supervisors, the analysts in the department. They must be willing to collaborate and communicate. They must have authority and accountability. And ways of doing that are certainly using a service level agreement with their users, with the stakeholders, physicians, entities that they support in a multi-entity organization. Project plans are an absolute necessity, and we'll talk a little bit more about that, in status reporting, making sure where are these expensive projects and how are they being managed, what's the status, how much of the budget has been used. Transparency and collaboration are extremely important. The IT leadership, or whoever the IT leader is, must be proactive. They must have a seat at the table and have access to organizational plans, critical decision-making information, no matter who they report to. They need to be involved in all software and technology discussions and decisions from the start. It has been my experience over my career that the best way to manage healthcare IT vendors or any type of technology vendor is for them to realize that they have to work with the IT division. They have to work with people who understand what they're selling, who know when, hopefully, know as much as they can about when they're being sold vaporware or vapor hardware. And that sends a strong message to a vendor that information technology is involved and engaged, and they're not working with someone that's out of their expertise area. Obviously, stakeholders, executives from the clinical areas, be very involved in all these decisions. I'm by no means saying IT makes the decisions, but they need to be at the table and involved with the vendor and asking those hard questions. One of the hardest things I think for IT and for a CIO is when you find out about a new IT acquisition after it's selected, but even worse, when the contract is signed and someone hands it to you and it's already got dates, deliverables, pricing, service agreements, and often then you have to sit down and renegotiate with the vendor because it's just not possible. And there's a lot of loss of money, loss of time involved in that type of situation. The CIO and the CFO can be an extremely powerful team and colleagues in not only making IT successful but containing those costs. Making collaboration and communication an absolute priority. You can't over-communicate. The CIO and IT leadership must be fair with yes and no and give logical explanations and translations of technology for stakeholders. I often hear from or read or talk to organizations where the CIO has become the no person. In fact, other executives may invite them into meetings just so they can say no because they have so much experience at it. And that's not the way you want IT or the CIO viewed. It's a resource in an organization, and it belongs to everyone, not just to the IT department. So you want other people engaged in what are the yeses and the nos, especially on large projects that are application-based. The CIO or IT leadership must set the expectation of very high performance from IT. It's a very expensive area. It's a lot of your cost. It's very critical, and the group must perform at a high level, and that must be expected from the staff. Must ensure that IT is laser focused on the core business, which is patient care, quality, and the organization's needs. They must drive IT value and benefits and prevent what I call technology for technology's sake. We all know that there's a lot of people in technology that do love new gadgets. They love the latest and greatest. But that's not necessarily where we need to be. It's not about technology. It's really about the organization and what its needs are. Another area that's very important is successful IT sponsorship and governance. The CEO must own as well as sponsor major IT projects. That's regardless of reporting relationship of the CIO. Board must at least approve system purchases. It increases the oversight. It tells the organization how important those projects are. The C-suite must be actively engaged in IT governance process and sponsoring IT projects. The CIO cannot go it alone. The person will not be successful long term, and it'll lead to turnover in many different areas. So it's really best that this is a collaborative partnership, and open conversation and transparency goes on in talking about IT and the projects and in governing the organization's IT resources. In fact, the business and clinical executives play a very, very important role in IT and in projects. They must be very engaged in being those change agents we often talk about, and I'll talk some about best practices and processes. But business and clinical executives must be accountable for IT projects supporting their initiatives. Business and clinical executives need to have the responsibility, if they're not the sole person, certainly have to work with IT, but they need to be justifying and securing the funding for key IT projects. This fosters ownership, from the executives on the front line and individuals and directors and managers and individual stakeholders in the organization to be a part of these projects and working together with IT. IT really cannot own all of this process. So when thinking about sponsorship and governance in IT in an organization, and over the last few months I've been talking with folks out in the IT space and visiting some organizations and talking with them about their IT sponsorship and governance. And I've been a little shocked to find that it may not be as strong as it always needs to be out in the marketplace. So we've been talking about IT steering committees for probably 20 years. Some questions that really should be asked of an organization that's convening an IT steering or governance committee, or is just looking at their current structure, or it's time to re-up that group and refresh, or people are saying, you know, it's time to do something different. One should ask what entities or areas should be represented on the IT governance or steering committee. What model should be used for representation, such as functional or federated? And I think this is particularly important where you may merge some type of an organization, whether it's physician practices, hospitals, any type of an entity. So are we going to do it functionally? You're going to have a representative that's ancillary, nursing, physicians, finance, CFO. Or are you going to do a federated where you have multiple entities of any type? Could be physician practices, and we're going to have a representative from each of them. That's an organizational area. If you've seen one governance structure, you've seen one governance structure. It really does need to fit the organization. So how will the committee make decisions and recommendations? That's an extremely important area. How is that going to happen? Because they do need to make decisions, not letting everything fall back to the CIO. What are the roles of the committee members? What are they going to be responsible for? How will the members be held accountable for owning, sponsoring, and communicating about IT projects? That's also very, very important, because there needs to be a responsibility for the members of that group to go back and communicate to the areas they work with. This is what's been decided by the IT steering committee or governance. How will members be selected? What will the term be? That's a very important factor. And in successful IT sponsorship and governance committee, roles and responsibilities are to set high-level policies, approve IS strategic plans, evaluate strategic programs and projects, approve project funding, approve project prioritization, and that is really the key. It's really making those hard decisions, and I'm going to talk some about how to achieve that in prioritizing. It's very hard because people often find themselves having to prioritize across an organization, having to decide is their project more important or less important than someone else's project. And they need to delegate the authority for the project level type decisions, the smaller decisions, to project teams that will report back to them on what those decisions are. There are other governance committees that are also important, especially with the implementation of so many electronic health records and employing of physicians. It's very important to make sure that the physician community, who may have joined organizations more recently, are a part of the governance in IT. Physician advisory or leadership committee is absolutely critical in an organization. And members should be certainly the chief medical information officer, if your organization has one, physician leadership, and physician IT champions or physician champions. The CIO will often sit in on the meetings, may or may not be a member, probably should not have a vote, but should be aware of what's going on and certainly able to answer questions. You may often have analysts from the areas that support the physician or a physician IT director. Should ensure that physician input, engagement, and understanding of IT initiatives, and should be chaired by, if you have a CMIO, could be your chief medical officer, could be a physician IT champion that's really interested in information technology and working with your electronic health records. Other governance committees that may be used in the organization. It may not even be a governance committee really, but the hospital user group. That may depend on your entity size. You may have one if you're multi-entity at each hospital. It may be one for clinicals, might be one for your financial areas, but they should certainly have input into project prioritization, especially the smaller projects, potentially upgrades, additional functionality, scope of projects. They can evaluate projects and give feedback, represent the operational viewpoint. It's always good in an IT department when you have staff that have come from being clinicians and working the actual roles. You don't always have that, but if you do, it's really, really good to also have the viewpoint of the people that are still out there working on the line, because it doesn't matter what you used to have, things are changing very daily as we talked about those new challenges. Should be able to identify and investigate a cross-functional issue. What starts in the lab may occur in pharmacy. It may move across clinical areas. Same with the financials. You know, many times if you have an AP problem, it starts rolling into general ledger and rolling across the financial system, or an HR and payroll issue. Should prepare project request for review. That's another role of the group. The executive and stakeholder engagement is very important. The CIO or your IT leadership must be transparent. In these governance meetings, the meeting agendas must be proactive and meaningful. You must do more than present updates and reports. I hear that so much as well. We had some really great updates and reports. Well, that's important. People do need to know the status. The stakeholders need to know where the projects are, but they certainly also need to be able to really be involved in what's going on and know what's coming up, those strategic projects that are coming, budgets, really engaged in the operations of IT. The CIO must include a very accurate picture of that status and present the good and the bad. They must be willing to share and support IT governance and decision making, that it's not all their decision. So that's very important that the person have that attitude. The CIO must foster, support, and require the prioritization of IT programs, projects, and budgets. Even though that's the toughest part of a steering committee, is making those decisions, it really has to be supported by the IT leadership and help foster that happening. The CIO and Governance Committee must collaborate and partner. They need to hold each other, IT, and the organization accountable for the success of IT programs and projects. That accountability cannot be understated with the amount of money being spent on these projects today, how critical they are to regulations like meaningful use, ICD-10. Committee members must be very proactive and engaged. I don't know how many times I've had colleagues and friends that I've talked to at conferences, or people I talked to across organizations that said, well, I think it's kind of come like we come for lunch. That lunch is important and we all know it, but it's not the main reason to come to the meeting. The users and stakeholders must be involved, engaged, and held accountable. Standard and strong project management is one of the keys to ensuring that people are engaged, that they're getting the information that's worth coming for. They're hearing about what's important, and discussions are occurring about issues, positive and negative, within IT and also within the user community. If there's a department that's behind on a project, that discussion may need to be had if it hasn't been resolved at the project level, the user level, within the governance committee. Prioritization of IT projects and capital expenses. This is probably the most important part of the presentation to me. It is one of the best ways to control and contain IT costs outside of the CIO and IT leadership doing a good job of leading and managing. It helps distribute the limited IT resources, both staff and budget. It supports the prioritization based on project value and benefits, or whatever the organization wants that prioritization to occur on. It prevents IT project failure from firefighting mode, improves quality and success of approved projects, improves IT operations and support, and it prevents that constant no mode in IT. In terms of the firefighting, it's one of the toughest things in IT. You're always going to have the unexpected, but you don't want to operate all the time in this type of mode. There are many ways to achieve prioritization. I've found over the years one of the very best is pretty simple. Classify projects into the must-do, the could-do, the should-do. And then you can use another classification with that or separately to be strategic, regulatory, the obsolescence, the things you have to do because the vendor's doing away with it or the hardware is just about to fail, and support. You can also do this through force ranking. You can use a federated model or a round robin depending on your organization. Value benefit analysis, and in some ways with prioritization you may want to create some separate tracks. If you have a large organization, a multi-entity, you may want to have some dollars set aside and a track for initiatives for a particular hospital, one that may have psych where another doesn't, or one that's focused very highly on a cancer center. Those may be funded by those particular hospitals. Again, organizational decisions. This next slide is something you can look at in the presentation. It's a very simple example of how this prioritization can take place and be kept up in a document. And now we've reached the time for our first polling question.
Thank you, Jackie. Thank you very much, Jackie. I will now launch the first polling question, which is, what is the most important factor in managing IT and IT costs? And the choices are developing an IT budget, CIO and IT leadership, managing service contracts, outsourcing services, or all of the above. And just a reminder, to receive CPE credit for today's webinars, you must be connected for 90% of the webinar and also answer 2/3 of the polling questions. And today, again, we have 3 questions, so please answer 2 out of the 3 questions to ensure that you get that CPE credit. Right now, about 80% of our attendees have responded. If you have not responded, please go ahead and do so. Again, it doesn't matter if it's a wrong answer, just select an answer in order to get that CPE credit. I'll let it sit for just one more second. Right now we have about 92%. Please go ahead and enter your answer. All right, and the results have shown that it's pretty much even split between CIO and IT leadership and all of the above. Jackie, which one's the correct answer?
It would be CIO and IT leadership.
All right, well, it looks like most of you got that correct. And now you can go ahead with the rest of your presentation until we hit polling question number 2 later on.
Thank you. Well, we're going to talk about best practices and processes. And you always want to have policy and procedure, but I don't think you want to have them like this for your electronic health record. It's an old adage that I start out with, and I got tired of hearing it years ago. And then we kind of forgot about it in the industry for a while, and now it's so real. People, process, and technology. It's like a 3-legged stool. If you drop one of them off, you're going to fall over. You have to have all of those today with the electronic health records and systems that we have in with CPOE, all of the types of systems we're now doing. We really have to have everybody engaged. And it's a pay me now or pay me later is very much my belief, is reimplementation is much more expensive than doing it once. I did a study some years back on an implementation somewhere that had issues. Not everybody had been engaged. Some departments had been left out. An organization that was part of the overall organization, an entity, had been allowed to lag. Went back and really looked at what was the cost of a re-implementation that should have been done once and done right the first time. And that cost was over 30%. Reading in literature, I've seen it can be as high as 50%. So you really want to do it right the first time. We really don't have those dollars. We never had them, but we really don't have them now. Garbage in equals garbage out. So if you put it in the system, it'll come right out on that data that everybody needs. System implementations must now, because we all know the enormous numbers that we see and how much they go over in the industry in implementing new systems that are integrated across physician practices and hospitals. It's really important to include standardization, best practice in change management, physician, clinician, and user engagement, and acceptance. It's not just implementing. You've got to make sure that people are adopting and accepting the system and the needed integration across the healthcare continuum that the whole industry is working on. Achieving best practice and process change really comes from leadership and expertise. It's best when it's internally driven and you own it. It's team-oriented and people are working together. Vendor assistance is an absolute requirement. They know how the system needs to be implemented. Shouldn't be driven by them, but assisted. Consultant assisted, depending on your organization, your dollars, and what you're implementing, and can very well be a hybrid of all of the above. I believe in looking at those who have been successful and not trying to reinvent success. Just mimic it and use it and go with what works and fit that to your organization. And most importantly on this slide is allow the time to do the process work. People always believe it's the area they can shortcut, and it's always costly to do that. In program and project management, there are a lot of folks in IT that don't believe that's important. I know how to do this. I can manage it on the back of a paper napkin, and I've met a few people who could have done that, but they were few. So would you start on a long trip to a destination without a map or an app? So why would you start on a project without one? Even experienced travelers are often derailed. You have to have an alternative route. Lack of planning and implementation can derail you very quickly. So I believe very strongly that all projects should have a project plan. It's part of the overall IT project portfolio that shows all the projects so you see what's going on today, what's active, what's out there in the future, and some high level of win that really should be shared with the IT Governance Committee, the C-suite, CEO, the organization. I believe very much in putting it out on a website, putting it on SharePoint. Let people see what's going on and make sure they understand this, like most things, will probably change to some extent, but it gives people an idea where they're going. You wouldn't try to build a building without a plan or a blueprint. And I've talked a little about IT portfolio. This is just a very high overall of what are good practices in program and project management, and that's to have an IT project portfolio with all IT projects active and planned, a project plan for all active projects, a functional or system project owner, that individual that sponsors the project, that's really the functional person, understands why we're doing this, is the leader. Project manager in IT that's got that roadmap, got that project plan, knows where we're going, making sure we're staying on track, and then that cross-functional IT team with vendors, users, consultants, whoever's a part of making the project happen. These are just some extremely high-level examples of what a structure can look like and how it can report up following that people, process, and technology. And having the executive project owner, system project owner, you can call those functional project owner, whatever your organization wants to, but it gives you an idea of what that structure and accountability really needs to look like. And it's now time for our second polling question.
Our second polling question is, what is the best practice for driving and achieving best practice and process change? The answer options are internally driven, team-oriented, vendor-assisted, or all of the above. And again, a reminder that to receive CPE credit for today's webinar, you must answer 2 out of the 3 polling questions today. Right now we're at about 85% voted, and I will leave it open for a few more minutes. Again, there's no penalty for guessing the wrong answer. All right, I'm going to close the poll in about 5 seconds here. And with all the answers in, again, it looks like it is split between team-oriented and all of the above, Jackie.
Well, it is all of the above. So all of those items are very important for achieving that best practice and process change. Sounds like we're ready to move on to our next, our last part of the presentation.
Yeah, go ahead.
In this section, I'm going to talk about cost containment, tips, and takeaways. A saying there that I really like by Oscar Wilde. It's important to know the value of all things, including IT implementations. Total cost of ownership. I know you've heard this bannered around in IT, and you really can't contain cost if you don't have the full picture of what it's going to cost you, or at least the estimate, because proposed IT applications and systems, in my opinion, should include a total cost of ownership over some period of time the organization feels is important. Could be 3 years, 5 years, 7 years. Years ago, I might have said, oh, it's got to be 5. Maybe it could even be 10. That's really not where healthcare is anymore. Things are changing so rapidly, and so is technology. So it could be as little as 3, 5, 7, whatever you feel is important. That should include capital, the decision of whether it's going to be a capital purchase. Is it going to be an application service provider that's providing it to you? Is it going to be software as a service in the cloud? What are those costs? It includes software license, hardware, infrastructure, implementation, staffing and consulting. Staff augmentation can be very expensive. You need to see what is that going to cost if there's not the resources to do it internally. Best practice and training. People often shortcut training, and that doesn't lead to good adoption of very expensive implementations. Hosting. Are you going to host it internally, externally? How's it going to be supported? What's the maintenance fees? Security, HIPAA. We all know how critical that is. Upgrades, new modules and functionality. Are you going to have to pay for them? Are they going to be part of the contract? So it is important to see this entire picture, and sometimes it's shocking to users or stakeholders. I've seen people bring forward something they really believed was a great deal. The vendor had said, oh, you're going to get it, this low cost. Then after you started helping them build this out and showing them what it was really going to cost, they'd look at it and go, there is no way. There's no value in that. So this is a very important piece of containing IT cost. Vendor partnership and management is another area of containing the cost. I believe in 3 types of vendors, and I particularly like number 1 and 2. A partner vendor. They have established track record with you. They're value added. They don't exercise nickel and diming on you every time you turn around. They have a long-term outlook at their business and your business, and they may even go at risk with you. Then there are the good vendors. They may be too small or really uninterested in partnership, or it doesn't make that much sense to do. But they're trustworthy. They meet their deliverables. They're very fair. Then there's the managed vendor, the one that's challenging. They're constantly nickeling and diming. They require oversight and management, and they have a very short-term outlook on your relationship. It's what kind of sale am I getting this quarter or this year? IT has to take a very active role in managing these vendors and acting accordingly. The vendor and selection process, vendor selection and implementation. I hate to say we've reached a point in the industry where for large overall system implementations, electronic health records, core system, what we used to call core systems, there are a few vendor choices. That leads to little negotiation. Whenever possible, try not to have just a one vendor show. These implementations need to be budgeted appropriately. Most large enterprise EHR implementations today go 30 to 50% over the original budget. One way to handle that, besides budgeting appropriately, is to budget a contingency for large implementations and projects. That depends on your organization, the amount of cash flow you have, what's your history been. But at a minimum, I often believe that it's important to put on a small project 10%. Really look at that and have it as a contingency. It's not allowed to be used. It's sitting there. Why are we going into the contingency if we have to do that? Vendor contracting is very important. Prevent acceptance of standard contracts if possible. They may be great, but don't just always take them. If you can negotiate them, make sure you go through them and see, are there points that would be to our favor that are needed. Have good contracting policies and rules that can be used for all contracts. Use expertise, an attorney or a good contract analyst. Contract management, ensure that you have contract adherence on both sides. The vendor's living up to their expectations or your vendor partner, and that your own organization and IT department are delivering. Make sure the expiration of contracts are being tracked to prevent a dollar escalation that you don't even know is coming because you didn't realize you were running off the end of a contract that if you didn't re-up, you suddenly were under a very expensive month-to-month. Timing of contract negotiation, extensions and renegotiations. Vendor quarters and year ends can be a really good opportunity. They want to get those sales in, get their numbers up, and that can be with a partner all the way through your challenging vendor. Sometimes going early, sometimes approaching the vendor and saying, I want to go ahead and do this. I want a contract for it early. It can be an option. It can have its costs, but you can weigh that out. And you have to always consider today vendor instability and mergers and acquisitions in that industry. We've seen a lot of consolidation of vendors in the healthcare IT space. We've seen many, many changes of what might have been a discussion we would have had 5 years ago and maybe even 3 years ago looks very different today in terms of HIT vendors. Budget management and cost containment. Believe very much in strong budget management of IT and implementations. I should have fairly told you that my background is actually in accounting before becoming a CIO. There are many different roles today. There's Chief Information Officers, Chief Medical Information Officers, Chief Nursing Information Officers, Chief Technology Officers. I personally believe that it's good to identify who is clearly responsible for the budget, or if you need to have it, what parts of the budgets. Identify how implementation expenditures are going to be approved. The Governance Committee, the CFO, the C-suite. Ensure transparency in budgets and expenditures with IT governance. The Chief Executive Officer, Chief Financial Officer, the Finance Department actively engaged. In one area, I often have people ask me, well, wow, we just have all these dollars going out. One of the ways during a new implementation, though it can be hard to do, is prioritize and stop some of your legacy system work to divert internal resources to high-priority strategic implementations and projects, therefore saving some of the dollars of having to do staff augmentation. Again, that governance committee pays off really well there when you can have those types of discussions. On the subject of staff augmentation, consultants and contract staff, evaluate the use of small firms versus a larger national firm. I've had very good luck over the years with using smaller regional types of firms. Often the national firms are just as inexpensive, but look at all your options. So don't rule them out because they may not have a big name in the industry. Word of mouth is good for finding the names of these types of companies. Make sure whoever you use to use experienced resources. You certainly don't want to find yourself paying a high dollar for someone who has 6 months of experience and really can't bring a lot to the table. One option can be to use one firm with a good solid negotiated price, providing them more business and you get a lower price. As we just discussed, you can backfill your internal staff versus contracting outside for a project. Use outside staff augmentation to do some of your support and move your staff to the new project. Payment based on milestones and deliverables at risk. I believe very much in standardization whenever and wherever. That goes for implementations, project management, and I've actually done studies and seen 30% savings on an implementation if you can standardize it across your organization depending on your size and across departments. IT and operational stakeholders and departments need to be actively engaged in process change and standardization. It really should be leading that operational piece, and there's a lot of savings to be gained. Areas like supply chain, surgical supplies, and scheduling is just one example. Use the buying power purchasing groups, especially if you're one hospital. You can join together with those, but I always remind people that make sure you check the pricing and what you get back on a rebate versus doing it on your own. Sometimes you can get a better deal. Outsourcing of IT services is a very large subject, but I know it's very active in the industry today. And vendor experience is critical. Make sure to check the listed and unlisted references. It is all about the contract. Beware of durations. I have seen an organization do a 10-year contract and be in trouble in year 2. You want to pay for performance, prevent nickel and diming, evaluate to ensure you get real long-term savings on outsourcing. Take an assessment of what that's going to do for staff transition and HR impact internally, and ensure you have an out clause. Disaster recovery and business continuity is a must-do today, and having a second data center or some type of services. A lot of this can be done through vendors. And another area to cut costs there is the prioritization of what's the most critical systems. Patients' systems are very important, but maybe you don't need to duplicate those nice-to-haves. Mergers and acquisitions can present an opportunity if you have a new hospital coming on that already has a data center, and use that as your second backup data center if it's far enough away. Software vendors can be an option, and you have to weigh internally your expense versus the risk. An area that's good to outsource is your security consulting and penetration audits. We all know about the Target experience. Some ways to extend the life of your current and future IT investments, and many of you already do this, I know, in the financial areas, to add bolt-on applications, web front ends that are on top of applications to make them more user-friendly, upgrade current investments and delay the new investments, consolidate and decrease current applications. Do you really need all those applications you're paying maintenance on? It's good every once in a while to do that big application inventory, keep it up on portfolio, and really look at, is this something we need to keep or something we can make a change in, and when could we do that? Contract for upgrades and future functionality at no or low price when you're doing contracts, or lock in those prices if you believe it's something you're going to need. And we have reached our third and last polling question.
Thank you very much, Jackie. The last polling question is, what are best practices for IT success and cost containment? The options are people, process, and technology focused, consultants, outsourcing, and cloud hosting, business aligned strategy, IT leadership, and IT governance, both A and C, or all of the above. And again, just a reminder, this is our last polling question today. In order to receive CPE credit, you must answer 2 out of today's 3 questions and be connected for 90% of the webinar. We currently have about 90% who have voted. I'll give it one more second and then I will close the voting. And it looks like, again, split 54-46 between both A and C and all of the above. Jackie, which one is correct?
It would be both A and C.
All right, and with that, I'll hide this question and you can move on to the next slide.
Okay, just to do a little summary of IT success and cost containment. Some best practices or business aligned strategy, good IT leadership and good IT governance, to exercise transparency and accountability out of both IT and the stakeholders, people, process, and technology focused, to look for partnership opportunities always with IT and IT with their internal and external counterparts, colleagues, relationships, and to practice cost containment wherever possible. That very important focus. And with that, I thank you very, very much for your time. Hope this information has been helpful, and would be willing to answer any questions.
Just a reminder, if you have any questions for Jackie, you can enter them in the questions section in GoToWebinar on the right-hand side of your screen, or also in the chat box as well. And in the chat box, again, there is the link to download the slide deck, which also, as you can see, has Jackie's contact information, and you can feel free to follow up with her if you have any questions that were not addressed today. It does not look like at this time that we have any questions. So with that, I will thank you very much, Jackie, for speaking with us today on financial solutions, prioritization, and cost containment in the IT world, and thank all of you for joining us.
Thank you.